in our day-to-day practice. Now, I have got no financial conflicts of interest to disclose concerning this presentation. Now, the first thing is, we will have a talk in the following heading. This is, we will realize, first I'll tell you what is chat GPT model, what is the practical use, then problems and practical use of AI, and how we are going ahead with this thing. The important thing is whenever we realize that chat GPT can do my job for me, we were very happy. Then we realize that chat GPT can do the entire thing for us. Then we are a little bit skeptical. I mean, are we going to lose our job? And that's how things have come to where, we a place where we used to learn from the textbook. Now it is a place where the chat GPT is teaching us. And there's a very important thing which has been told saying that artificial intelligence will have a more profound impact on humanity than fire, electricity, and internet. It was told by Sundar Pichai. And that's the fact, no matter whether we believe it or we don't believe it, it has come to stay. And I'll tell you how the things are. I'm sure few days back, you must have read in your newspaper that there was a major train accident in my place where I stay, that is in Siliguri, just near Siliguri. There's a major train accident when a Kanchenjunga Express rammed a goods train, and there were about 10 deaths and a lot of injuries. Now, if we had an artificial intelligence at that moment in that track, we could have prevented that accident. They say railway collision system, whatever it is. Basically, it is nothing else but intelligence which will apply brakes and stop this train and would have saved so many lives. So that's the importance. I'm just telling you how the current topic is important. We could have saved the entire accident had we had that artificial intelligence installed, and had we had that thing. Though Northeastern Frontier has introduced AI-driven safety system, blah, blah, blah. But then, when this accident happened, then they realized that this process was not there in my place, and there was a loss of life and, a lot of injuries. So that's the importance, and that's how the things are. Now, artificial intelligence in our daily life, we are using, it, like biometrics, we have social media we are using, virtual assistant we are using, navigation system you are using the moment you put in your car on, and of course your language translators and your autonomous driving system, especially if you are driving a Tesla. Now, in medicine, we have other things like I have already covered this. We have AI chatbots. We have a lot of watches. We can see everything in our watch, wearable devices. We have virtual assistants for e-health records. We have AI platforms for MRI and all these imagings. We have deep learning algorithms for ECG and many other analysis. And of course, we have surgical robots. So in surgery also, we have come a lot in AI, and apart from our daily use. But then there is a very important thing which came out in 2015, and that's how it's becoming a fact. That means that they have said the future of medicine is in your smartphone. And that's fact. With your smartphone today, you can do everything. You can measure your pulse, BP, even saturations. So, you don't require anything. Your entire AI is there in your mobile. And with this, you can not only take care of yourself, but you can also notify your near and dear ones if there's some problems. Now, basically, what is an AI prompt? That means AI will not work otherwise unless you give him a direction or a prompt. What is it? When you are giving an AI prompt, that means when you're asking a question, you have to define the task. You have to ask an open-ended questions. You should have a person or target audience. Whom are you targeting? And provide clear instructions. Don't confuse it. And be specific and provide context. You must provide the context in what we are seeing. Now, the important thing is whenever you're giving a prompt, and if your AI is not giving a proper answer, you are also supposed to tell the AI that this answer is wrong, because only then it will rectify the mistake. And next time when you give a prompt on the same question, it will give a correct answer. What I mean to say is this technology, ChatGPT, has not become till now 100% foolproof. It is we who have to give the proper answer. We have to direct it. That means when you are giving a prompt and you feel that answer which is given is not satisfying you, And when you verify it is wrong, you have to go back to AI and say, this is wrong. You have to give this answer. The more you feed these answers in your AI, the next time AI becomes smarter and will be able to help you much more in a much more smooth way. Now, for students, it is able to, what is able to do? It is generating new ideas. It is able to write emails and a lot of applications. It is summarize or paraphrase. It is generate practice questions and make question banks. It is also helping in solving problems. And of course, for my postgraduates in my college, they are even helping them in thesis, thesis topic. So as a student, they are able to generate ideas for essays. They are able to run spell checks and grammatical mistakes, whatever it is, through this chat GPT. They are able to write academic mails. That means if you want to write some academic mails to some vice chancellor, or you can get the entire thing written by that. And of course, you can generate practice questions for tests. Now, how to use the chat GPT? Basically, you have to use register on a chat GPT website is available. You have to provide your email and create a password. You have to verify your email, provide your name, and then start using chat GPT. And then, you have to manage, create and manage chats. That means you have to give prompt and you have to manage those chats. I'll come to that, all those things, because it helps in saving time. It's helpful in giving new ideas. It is basically a multiple language enabled, and there's having a lot of computational and technical abilities. Remembers the previous information. That's again, it can remember. There's a flaw. I'll come to that. There's a flaw in that also, but it remembers the previous informations and it declines inappropriate requests. I hope I'm clear what I'm saying. And then, it is a one-stop manager. It's like your personal assistant, or PA. You don't have to pay to a PA. You just use your chat GPT and more or less you can get all your work done. In other words, it decrease reliance on human resources. It does greater efficiency. It enhances the accuracy. It enhances the personalization, and it also decreases the labor costs. Now, thing is, can ChatGPT give surgical advice? Yes. Now, there are two ways to look at it. If you use ChatGPT, we used to say that it will grow only information from 2022 or earlier, but now they have modified it. It's not like that. Now we are getting current information also. But there is something called a Gemini, which is in Google, and it draws real-time information from the internet and provide multiple responses to the question with sources. Now, the problem with ChatGPT is that will never give you the references. So if you want writing something, sometimes you may have difficulty in getting the references. But if you ask the other part of AI, that is Gemini, it is also give you the references from where it is taking. But nevertheless, we have 3-4 types of chat GPT. The important thing is we used to have chat GPT, GPT-3, GPT 3.5, but now the present thing is GPT-4. It is very important because you should understand that it is having a word capacity, memory capacity of 25,000 to 64,000 words. It is more or less more than 80% accurate. Unlike ChatGPT 3 or 3.5, ChatGPT 4 is more or less more than 80% accurate. And the important thing is, apart from this text and speech, you can also give image, and that will help you in building the image. So for the image, text, and speech, ChatGPT is the best. So that means if you are thinking of using which one, I'll prefer you to use ChatGPT 4 because it's going to help you in all these things. Now,
welcome to this
I'll give you a small video.
Chart2Chart's innovative virtual assistant feature. This powerful tool is designed to streamline the diagnostic process, making healthcare more efficient and accessible for both patients and providers. Let's walk through how it works. To begin, the user simply clicks on the Virtual Assistant button within the Chart2Chart app. Immediately, they're presented with a selection of common symptoms, everything from abdominal pain to anxiety, chest pain, and more. But what if their symptom isn't listed? No problem. Users can easily type their specific concern into the chat field. For this demonstration, let's say our user is experiencing heartburn. Once they select or enter this symptom, something remarkable happens. Our virtual assistant taps into a vast database of over 30 million medical references. It's like having a medical library at your fingertips, working to determine the most relevant follow-up questions. After confirming the user's choice of heartburn, the virtual assistant begins its targeted inquiry. It may ask about related symptoms, such as regurgitation or difficulty swallowing. This isn't just a pre-programmed questionnaire, it's a dynamic, intelligent system adapting to the user's specific situation. Now, here's a feature that sets Chart2Chart apart. If a user is unsure about any symptom or term, they can simply tap the question mark next to it. Instant clarification, right when they need it. This ensures that the information gathered is as accurate as possible. The virtual assistant typically asks about 8 follow-up questions. This might seem like a lot, but each question is carefully chosen to gather the most crucial information. And remember, this process is often much quicker than waiting for an in-person appointment. Once enough information is gathered, the virtual assistant presents potential diagnosis options. In our heartburn scenario, it might suggest conditions like laryngopharyngeal reflux or Barrett's syndrome. But we don't stop there. Users can dive deeper into each potential diagnosis by clicking the Read More button. This action unlocks a wealth of information from trusted sources like WebMD. The virtual assistant goes a step further by highlighting specific areas of these articles that are most relevant to the user's symptoms. It's like having a medical researcher sifting through information to find what's most pertinent to you. For those who want to explore even further, another click on Read More will navigate them to an official PubMed website. This gives users access to peer-reviewed medical literature, empowering them with the most up-to-date research. But here's where the Chart2Chart virtual assistant truly shines. By the end of this process, it has compiled a comprehensive summary of the user's symptoms and potential diagnoses. This valuable information can be shared directly with the user's healthcare provider. Imagine walking into your doctor's office and they already have a detailed overview of your symptoms, potential diagnoses, and relevant medical literature. This is the power of Chart2Chart's virtual assistant. It speeds up diagnosis, streamlines treatment planning, and ultimately accelerates recovery. The virtual assistant isn't replacing healthcare providers. It's enhancing their ability to provide efficient, informed care. It's a perfect example of how Chart2Chart is revolutionizing healthcare management, one interaction at a time. Thank you for joining us on this demonstration of Chart2Chart's virtual assistant.
So that was
Transforming
a
healthcare
small demo.
simplified.
That was a small demo. I just wanted to tell you
Welcome
how the
to this
things
demonstration.
work. And, that's how it happened. A boy saw 17 doctors over 3 years for a chronic pain. Then her mother was frustrated and she turned up to ChatGPT and found the answer. She fed all the symptoms and the answer came as tethered cord syndrome. And that means there's some attachment. I mean, there's some spinal cord attachment problems and all. And she got the diagnosis and the boy got cured. So, in spite of seeing this, instead of 17 doctors, there was no diagnosis. It's the mother he fed entire data in the chat GPT and got the answer and got her child treated. So that's the important thing. And even in cases like pathology, Dr. Sanjay Vedi is there. I can tell you there is a very important thing which is happening in wound management. There is a AI called Illuminate. That can, even if you use that AI, it uses multispectral autofluorescence imaging and combined with machine learning, it can classify pathogens on wound along with, their automated wound measurements in 2 minutes. If you are doing a culture sensitivity of the wound, it comes in 3 to 7 days. But in 2 minutes, it will tell you what organism it is having in the wound, and you can give it the report also. So that's the importance, color. When the moment you use Illuminate thing, your culture, you don't require culture. It will tell you the wound, the pathogens. It will classify the pathogens, and it will detect also. So, it gives the right treatment. It gives an accurate, targeted debridement, and you can do a continuous wound monitoring also through this AI. Now, what else can ChatGPT do? It can draw diagram. You want to create a logo. Suppose, here you see you want to logo of a Mossy coffee. Immediately, be a beautiful logo. You can create logos. If you want logo of your clinic or in your hospital, you can ask ChatGPT itself. It can give beautiful diagrams, bar diagrams, histological diagrams, all these diagrams, bar charts, everything comes out very well with your chat GPT if you are using it. But your prompt should be very important. That's what I was telling. I'll give you an example. If you give a prompt like explain this medical report to a child using simple language, no metastatic thoracic lymph nodes, thyroid stoma, no pleural effusions. ChatGPT will immediately generate two responses. One is the thyroid gland is a butterfly-shaped a gland in the neck, it looks like a bit bigger than usual. Another generated this. They also saw that the person had an extra thyroid gland, but there was no infection in the chest. Now, you should have the IQ to know which response is correct. ChatGPT has given you two responses. You know the first one is correct. Now, when you make it correct, it is your duty, as I told you in the previously, to go back to ChatGPT and say, this is the correct response, so that ChatGPT rectifies and becomes smarter. Now, similarly, they have fed the entire TNM report of a lung cancer into ChatGPT. They have given a prompt, they have fed the entire thing, the entire religion report, and they have put it in the ChatGPT. They have found that it has been seen that ChatGPT has been useful in giving lungs cancer staging. In T's category, it was 52% accurate. In N category, it was almost 80% accurate. And in M category, that is metastasis, it was about 87% accurate. So in future, you may be seeing this more and more use of this. You don't have to go and sit calculate your TNM staging. You just feed the report and you get everything. Now, if you are a writer for a journal, it is a very, very helpful thing. It will help you like anything. If you're submitting your manuscript to any of the index journal, they are very particular. And even for this, for doing some studies like meta-analysis, this is one place where I think ChatGPT will come a big way very soon. Because in meta-analysis, you feed all the data together and you ask ChatGPT to give you a summarization, because you don't have time to sit everything. It will do everything. It will give a research design. It will do a complete meta-analysis. It will summarize the thing and also give you a literature review. So apart from the research conceptions, it will help you in your vocabulary enhancers, grammar checking, spell check, and citations checking. It will also help you in your language, in your, if you want to do paraphrasing, as I told you, if you want to title and keyword generations. It will also help you in academic publishing, like you want to know which journal I must send, which is the best journal for you to send this manuscript. It will tell you the journal finder. It will tell you the journal style formatting, how the peer review is done, whether your manuscript has gone for ethical compliance or not, and whether there's a technical compliance there or not. So everything you have to do, you don't have to sit and use your brain. You write a manuscript and you feed it, and it will give you everything. But for meta-analysis, it is coming in a big way, because, previously meta-analysis used to be a headache, sitting and compiling. But now with this ChatGPT, it is going to help you. And last but not the least, for plagiarism, many of the journals will not accept your article, even though how much you do. If your plagiarism check is not less than maybe 10% or maybe 15%, that ChatGPT will help you out. So in other words, it will do the fact checking, it will do plagiarism-free copy, it will give proofreading, it will give editing, grammar checking, everything will be done with your, because for our Indians, the most of the time, when you send your manuscript to your foreign thing, they ask for the language. They want the native language person to have a look in the thing. So that's the thing. But with this ChatGPT, you can do all these things in a very, very smooth way. For a person, you want to read some other language thing, you are not, it's a German or a Spanish. Again, you can use your AI and ask this thing to be interpreted, to completely translate the thing in the PDF in Spanish or French or whatever it is, and you can read that thing. Unlike previous times when we have to do it, but nowadays with the AI, you can do a complete translation of the entire manuscript in other language. So in other language also you can use it. And finally, it is useful in your clinical documentation improvements, which is known as CDI. That means you can give prompts. You can documentation becomes very important with the ChatGPT. You can give translate the sentence from English to French, or I need the Japanese translation of this word, or translate the sentence from Russian to English. And it does anything, all these things, the moment you give a prompt, your answer comes out on your screen. and you know other thing. And how does it helps in your operative notes? When you have done a surgery, suppose you had a surgery, you have to just tell this surgery, and it will create a beautiful operation note for the surgeons. It has been seen that ChatGPT, of course, you have to read it and you have to say if anything, you have to add different thing, but it will create a beautiful operative notes. Now, another thing is, like today's webinar we are having, at the end of webinar, if you want to know what is the, you want to take a minutes of the webinar, if the ChatGPT is listening, it will give a very nice meeting notes. So when you are having a conference, there is multiple people, like a symposium or something like that. At the end of the thing, you can ask ChatGPT to summarize everybody's views. It will give a beautiful meeting notes. And for OT notes, you see that I've written the if you see the left side thing, you can see the OT notes. It will give everything. It will fill up everything: name, patient names, chief complaints, what was the anesthesia used, technique, assessment plan, everything. It will give you by using the AI. So what is now said is never write a clinic note again if you are a AI addict or you know how to use the AI. Your subjective, objective assessment plan, everything will be taken care of by AI. All you have to do is you have to just tell what we are having, and AI will make the thing. What is the plan? What is the assessment? What is the objective? Everything, for the patient's conversation, as you're talking to the patient, it is making the points noted, and it is going to give you an automatic SOAP notes as you talk with the patient and take a history, and they are going to help you in your treatment. It is also going to help you in your progress notes. You go to the thing and you tell the thing, and it will write your progress note also. So doctors are going to become very lazy very soon, and nobody would like to have a manual writing SOAP notes in your case sheet. Everything will be through AI. So ultimately, it will be like this. When you are seeing a thing, when you are asking AI, what is it? AI will take care of your demographics. It will take care of history, physical examination, investigations. It will take care of the ICD-10 coding. It will take the plan. It will make the assessment. SOAP, as I told you, it was a chart. So what are you supposed to do in the hospital? Everything is taking. Only thing is you have to feed the data, and it will tell you everything. For example, in this thing, you see they can observe the BP, heart rate, respiratory rate, oxygen saturation. Everything is taken care of that. You just feed you to go and you just check. It will also tell you the follow-up appointment date. It will also tell you follow-up next when you should come. When everything, all those things will be taken care of by the AI if you are using it in your clinical practice. So if you are, as I told you in my first video, as I told you, all you have to do is you have to symptom checker is something, tool is, if you are telling that I'm having weakness, chest pain, travel history, it will immediately tell you what are you suffering from. So basically your medical AI chatbots will tell you about symptom. It will be a virtual administrator. It will give you informational support by giving literatures. It will tell you your health tracker. It will give you pharmaceutical guidance. It will give you a chronic disease management, medication adherence. You are adhering to medicinal emergency trials, and last but not least, it will be a personalized patient insights. So is it as if you are being taken care of by somebody unknown, and there's somebody who's taking care of you. You don't have to bother whether I know the things, or there is some support or some personal assistant of yours who's taking care of you, and you don't have to bother anything if you are using this. As I told you, the plagiarism checker, again, I've used this and I found that, in certain things, it is able to tell you that this is about 70% this manuscript is plagiarized. And, they are doing it quite correct. I checked it with the other software also. And I found that AI is reasonably well doing this thing. So I'll request all those who are writing journals, writing in the journals, please use this. And it is able to also do a literature review. So these are the benefit. Now, for a conference, suppose I am talking today in front of you, in a conference, when you are presenting in a conference, how you plan your conference, if you look at it, you first introduce yourself as Dr. Sanjay Bedi has done to me. Then you describe your outline talk. Then there's a motivation. Then there's a methodology, results. Then you conclusion. There's a time for applause, and then question answers. 15 minutes. You go like that. But what happens in a real conferences? Something very, very what it has shown. If the previous speaker has runs late and he has eaten your time, there's a technical difficulty in connecting your laptop, and there will be some Wi-Fi connectivity problem. Then you forget introducing yourself. then you spend way much time describing your outline, and then then you realize that there's only 3 minutes left, and then you run through your slides in the last 10 minutes. This entire problem will be solved if you are presenting it through AI. You have to just tell, I have got 20 minutes. It will fix your time and it will do the entire thing in 20 minutes so that you don't have to bother. It's like a co-pilot AI. You use your co-pilot like that. You say, I want to generate a presentation and I've got lost time. Please make it from 30 minutes to 20 minutes. It will immediately do it. And you will not even realize how it has done, but it will do it. So that's the advantage in presentations. For surgeons, AI chatbot is telling the robots, helping in suturing. Can you believe this? Not only that, I mean, if you feel that surgeons are giving order to chatbot, now you suture like this, it will suture immediately like that on table. So that's again one like a virtual assistant for surgeons, which translates the text into, commands, and the robot is able to do everything. They will tell you how to suture everything. You have to just give command. So basically, now we are like a smart wearables. We are wearing all types of smart things: smart socks, smart pants, belt, ring, finger, bracelet, glasses, smart watch. So everything we are wearing now, where we can control and do everything with our AI. Now we have done a publication on immunosurgery on the recent thing, which was a Neuralink. There's something called a brain-computer interface, and it came out with Elon Musk. And he said, I'll introduce a chip in our brain, and through AI, that chip will take care of everything. It will treat the disease also. It will think like a human being, and if somebody is having or some kind of epilepsy or depression or deafness or pain or any type of motor neuron disease, with the chip, it is going to help to control it. So in essence, what Elon Musk is doing is he is able to control our brain. So that means, with the robot, he's making what was, he's able to make a robot thinking robot. It's not like just working robot. So, what he's trying to do is he's making the robot think like us. So let's see what awaits us. So, this is one thing which is coming in again, he's putting all his efforts to make this thing work. The issues are, of course, privacy, patient safety, and of course, discrimination. We wrote our another article on predicting the post-op surgical complications. This is again one place where our AI is coming in a big way in surgery, where we are able to predict the complications going to happen. But what we are looking at it basically is in laparoscopic surgery, there's something called a learning curve. Anybody who learns suppose laparoscopic hernia or something, they have to do at least 50 to 75 cases from the laparoscopy before he is supposed to be an expert or specialist of doing a laparoscopic hernia repair. So like that, is there some learning curve even for robots? Now that part of the story, nobody knows till now. We are still waiting. What is the learning curve for the robots? Or you just can't ask anybody to jump on the robot and ask him to do surgery. That will never happen because there will be a lot of mishaps, and there has been a lot of deaths also reported. So this is the things which you have to be careful. So in essence, we on a pre-op cases, we are able to select with the 3D planning. We are able to patient selection with the pre-op 3D planning. We are able to do complete planning with the 3D. And then we are going to do for robotic surgery. And finally, we could monitor the patient and measure the surgical results and optimize the patient management with your wearables and connected tools. So everything, from the entry of the patient to the exit of the patient is your AI controlled with your AI-based tools and completely with AI controls. So that's how the situation is going to be in another 10 days, in 10 years, in another 10 years. Be ready for that, and we have to accept this when it comes. So the pros are basically, it's precise, it's accurate, it's used, basically can do laborious tasks. It is able to do fraud detections and manage records. It lacks the emotional side, of course. Can do repetitive and time-consuming tasks. You can tell him to go do again and again. It will not get irritated like us. It can do robotic radiosurgery, and it functions without stopping, and it can do diagnosis and treatment. The cons are basically, the cost, and lacks the human touch. It does not have a creative mind, lacks common sense. It may create unemployment in the lower categories. And a time may come when the robots may supersede humans. That we are waiting for that if it comes. But the last thing is, the human, I mean, the doctors or in general, the people, humans will become dependent on the robots and machines on AI. That's again a problem. And last but not the least is, if it falls in the wrong hands, it may cause destruction, because you understand, things will not be, everybody will not be same like us. If anybody wants to destroy also, it can. So Elon Musk has said very important thing, mark my words, AI is far more dangerous than nukes. Now, I tell you, now even for the conference, suppose you are holding a conference or anything, how do you send the invite? See, the organizing secretary just puts his photograph and he invites everybody. I'll give you a small example. And this has been for the BASIC on the Bihar chapter of ASI. The organizing secretary, Dr. Tabrez, is inviting us like this.
Dear esteemed surgeons, I, on behalf of my entire team, honor to invite you to the 43rd Annual Bihar ASI Conference BASICon 24, which will be held in Motihari from November 28th to December 1st, 2024. The event schedule is as follows. November 28th, 2024, pre-conference. November 29th, 2024, live operative workshop. November 30th to December 1st, 2024, main congress. BASICon 24 offers an excellent opportunity for professional development, networking, and sharing the latest advancements in surgical practices. This year's scientific program will have several innovative sessions, including lectures, panel discussions, symposiums, debates, and orations. Dedicated pre-conference courses along with live operative workshops, free papers, posters, and video presentation sessions, along with the quiz provide residents and young surgeons to present themselves to the world. Your participation will be highly valuable and greatly appreciated. Please save the dates and join us in Motihari for this prestigious conference.
That was our organizing secretary, Dr. Umar Tabrez. Now, believe me, this has just started. Nowadays, next step will be all the conferences will be like this, which will be personalized. And, even in marriage invitations or any other invitation, it will be like this. You put your photograph and you talk. The disadvantage is, sometimes people can put your photograph and talk something which has not been spoken to you by you. And, there can be a fake AI voice, and that may create a lot of problems. So that, again, like deep fake videos or fake AI voice, people can take the photograph out and put the voice behind. It looks as if you are speaking, but you are nowhere in the scene. Now, that's the entire thing. When fake news meets artificial intelligence, the risk is robots will lie, leaving us with fake intelligence and artificial news, or exactly where we are now. I hope I don't have to explain this sentence. And we are in that place. You read so many things in WhatsApp and your Facebook, and when you go back and see, you see they are all fake news. So this is where we are, and that's a problem with AI. We have to be very careful about it. I'll give you another example. This has been a publication, it came out as a successful management of an iatrogenic portal vein. And if you read the yellow sentences, which has been covered, that the author has written, in summary, the management of the bilateral iatrogenic, after that he's writing, I'm very sorry, but I don't have access to real-time informations or patient-specific data, as I am an AI language model, and I can provide general information about managing hepatic artery, portal vein, blah, 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 but not specific cases. You understand who has written it? It has been written by an AI. It has been sent for publication. I don't know how it escaped the eyes of the reviewers. It got published also in radiology case reports. All right. I'm not telling you a thing. I'm just showing you what has happened. Now, if you say this, when it became a big nonsense, if you see the other side, it was removed. And you see this was removed June 2024, just few days back, it was removed. And then they understood that this was completely done by AI. That's the problem. When you're using, the disadvantage of AI is, these are the things I'm showing you how it can happen. So basically, when you are using ChatGPT, you may be violating your privacy rights. That means data collection happens with ChatGPT with no legal rights. Data collection without notification. violation of accuracy principle. There is a lack of effective age verifications. You don't know what the age of the person who is collecting it, or what is the, I mean, they're collecting from which age. And of course, for the children, there is a lack of parental consent verification. That's the right reason many countries have banned ChatGPT, because of this. And then another disadvantage of ChatGPT is it is known as ChatGPT is bullshit. There, somebody has published. You know why? Because ChatGPT causes AI hallucinations. You know, you feel like, you know, it make you hallucinate. So that's again, you have to be very careful, because you do not know whether it is a truth thing or it is going to it's only hallucinating. So this is one side effect of ChatGPT. Well, it will make you hallucinate. You know, you feel that yes, I have done it, but you have not done it. Now, 60% of Americans say they will not want an AI-powered robots to be used in their own surgery. Maybe the status is changing now. This was in 2022. They said we will not use, because they were afraid that there's any robots with artificial intelligence will not be a proper thing. But a major concern with autonomous surgical robot is, you know, responsibility, liability, accountability, and the last but not the least is culpability where surgical error occurs. Suppose your robot fails in the middle of surgery and the patient succumbs, who is responsible? Will you catch the surgeon or will you catch the robot? Now, you know, you have heard a few days back, you know, there was a paper leak in NEET and a lot of exams got cancelled. Now, let me tell you, there are two ways. I'm showing you both the ways. If you are using your AI, you know, people have used AI for and Bluetooth for cheating. You know, I mean, they have used your cheating for purpose also, which AI and Bluetooth, they have transferred the question paper. That's one way. But now, when the NEET exam got cancelled, there are a lot of thinkings. Why cannot we do it in a AI base? That means, you know, question paper will have a fingerprints and it will open up, and you know immediately it will be locked, everything. So, you know, if you introducing AI, and your answers will come out on the screen immediately, you don't have to wait for so many days for the answers. The moment you put your enter last question's answer, your answer will flash in your screen, and you know what's your rank immediately. So there will be not much of, you know, and every questions there will be, you can create so many groups with permutation combinations with AI. It's impossible to do this copying or cheating. You know, you can't flick the question paper the previous night. So now the present thinking is, if you are able to introduce AI in our exams, maybe we can do a full proof our medical exams or any of the exams, and this problem will not occur again. Now, before I stop, you know, recently we have seen that this is yesterday's news. Your AI has entered your WhatsApp, Facebook, Messengers, and Instagram in India. It was there in US and other countries, but in India, the moment you are doing your WhatsApp, you want to know something, you write there at Meta AI. Please tell me the definition of something. You know, they immediately you find that with your mobile phone, your AI will work and tell you the entire information. So artificial intelligence has entered your day-to-day life also in WhatsApp, Facebook, everywhere. So you have to accept that. So the last word has been, I hope I finish in time. There is no reason and no way that a human mind can keep up with the artificial intelligence machine by 2035. So we have to gear up and we have to understand, we have to learn this technique. It's not that we can say don't want to use it. You have to see both the sides of the coin and choose the middle. Thank you, sir, Dr. Sanjay Bedi, sir, and the MU India for giving me this another opportunity. Thank you so much to the audience for having the patience to listen to me.
Thank you, sir. Thank you for another illuminating talk, and I'm sure many of us will be now activated in actually using these methodologies, maybe in a learning, self-learning mode. And so the floor is open to questions. You can unmute yourself and ask questions. In fact, there are some questions in the chat box also. You can just go through it.
Dr. Bhattacharya, I am Dr.
Yeah.
Suppe actually.
Tell me, sir.
Excellent talk. Actually, I enjoyed your talk, last talk also, and this talk also. And this is more specific to the surgery, what is really happening. I think overall, what you really said has two components. One is in general chat GPT, which is I'm sure all of us are using it. But for specifically for surgery, I think we are still a little reserved about using it for maybe preoperative planning, yes. But actual surgery, we are still little holding on it. But I'm sure the day will come when we will all start using it actually.
Yes, sir. I'm sure, sir. It will be is coming, sir. Now that it has entered your mobile phone and everywhere, it will definitely be coming. And I'm sure everybody will be using it very soon now.
I have one question to you actually. What is your, may not be related to surgery, but what is your opinion about this DNA nudge technology which is coming for diabetes remission?
What
Where
technology, sir?
DNA nudge technology, where they have been trying to create avatars and then they treat with the help of AI, diabetes remission and all. Have you read about it?
I have no idea, sir, about that, sir.
Okay, sorry. And the
That's okay, sir.
second question I wanted to ask you was about that. Uh, you showed that Bihar Asicon thing, no?
Yes,
So
sir.
how easy it is to create?
It is very easy to create, sir. All you have to do is take a photo and you have to just talk. It will create immediately. It is very easy, sir.
So which app you go in this?
You can do it any of this. There's AI photo generator and all this. If you go to the net and you say, I want to create a thing, it will immediately give your voice and it will create, sir.
Okay, sure. Thanks.
Yeah, good evening. I am Dr. Philip, urologist basically. I
Sir.
have put the questions online, but still I'll repeat.
Sir.
Now, this AI can help you in diagnosing and planning the surgery if required. Do you think AI can influence the outcome other, because the primary person doing is the surgeon? Now, how will AI, can it help? And if you go by that AI decisions, if something goes wrong, who will be held responsible?
That's a very good question, sir. That's the entire essence is the entire thing is now that only. But then AI is going to give you options, sir. Now it is you who have to select it. It is not that you have to totally depend on AI. Where you think that I do not know something, or you feel that this thing I want to know, what is it? So AI will give you all these options. The Chat GPT is a very minuscule thing of the things. I mean, whenever you're writing AI, that I'm talking about in general, it will create the entire thing and to tell you this is the one. The thing is, as I told you, it is you who have to decide which is correct and which is not correct, sir. You don't have to
The
depend on that.
problem is you are going to look at it because you are not sure. Then
exactly, sir.
How will you take which one is correct or not?
No, for that, sir, the important thing is you should have that. You cannot depend on chat. Still now, Chat GPT has not become essence like, where you can totally depend on it. I will not say till day has come till now. So you should have the judgment. And if you feel, as I told you, sir, if you feel that the A is correct, B is not correct, you must immediately go and tell the Chat GPT A is correct. So that if after somebody else put the same question, he will get the correct answer. So the thing is that Chat GPT works in the more you put data, it will give you that correct information. So
And
data has
more
to
and
be
more you
correct.
run the thing, it will be more accurate comparatively than initial time.
Yes,
So
exactly, sir.
unless you train that system into that, it will be difficult.
It will be difficult.
It has to be trained. We don't know how long you have to train, how many times you have to train, so that you will get a foolproof kind of a result
Exactly,
at the
sir.
outcome.
Philip,
Sir.
Dr. Philip, you
Yes,
go on
sir.
putting every day you operate a case, you put on AI, I'm sure by about 6 months it will be ready to answer your right questions.
Yeah,
Avinash sir, good evening, sir. Nice to see you here, sir.
Yeah. I really enjoyed your talk. Really. Sanjay, thank you so much for organizing this.
Thank you, sir.
Amazing.
I mean, your presence, we are honored by your
Yeah,
presence,
we are
sir.
honored, sir. It's so great to have you here, sir. Avinash sir.
Yeah. Actually, I am in Guwahati, but I never wanted to miss your talk. So
Thank you so much, sir. Thank you. It's an honor for me.
Sir, can you put your email and phone number? I'll try to
that, sir.
contact you by the thing.
I'll
Your
do that.
initial slides had that.
Sir, I'll do that, sir. Sanjay sir, any other things?
Yes, the topic is open for questions. For anyone else with any questions?
Okay, sir, since nobody is asking, I will only ask. Has this AI gone wrong in any diagnosis when it is being trained optimally?
When it is trained, sir?
When it is trained optimally, where you can expect reasonably good results, has
So
it
that's what
gone wrong?
Yes, sir. The diagnosis I showed you, sir, one doctor, 16 doctors missed a diagnosis. The mother was frustrated and she fed the entire data in the thing and got the correct diagnosis. So things have come to that level, sir, when people are thinking that if the diagnosis is not correct and they feel that they want to have a second opinion, they will be on ChatGPT, sir, very soon. I mean, I am finding a lot of patients who are taking the help of ChatGPT to find out they are using it as a second opinion, whether the doctor what is saying is correct or justified or not, sir.
Is that a warning to us?
I won't say a warning to us, sir. As long as we are ethical and we are correct, I don't think ChatGPT can take our place any day, sir.
Okay. Yes, sir. Thank
Yes,
you so
but
much.
it is a very good
one
tool.
question, Kaushik, I have to you.
Sir,
So your screen shows dictate. What is that actually?
dictate, sir, that means a prompt, sir, nothing else, sir. It's like a
So
prompt.
if I create like this and then I dictate, will it type in PowerPoint?
It will forward, sir.
Oh,
In fact, now there is a developer mode in also in designer mode in PowerPoint, and it will create your PowerPoint slides also with images.
I showed you that, sir, that it will show
Yes.
you everything. It will time your PowerPoint also, sir. Suppose your time is short, it will time your PowerPoint also.
Areva. Thanks. This is something which is learned. I learned it today.
Yeah, because in conference, suppose you think that you are given 30 minutes talk and suppose they cut short because you make it 20 minutes, it will do the entire thing in 20 minutes, sir.
Without missing the...
Without missing, sir. Without missing. It will know how to do it. It will definitely do that. It will adjust the slide accordingly.
That means you are the one behind it.
Yes.
Ultimately, it is the person.
Yes, sir.
Whatever this thing artificial, it will be still artificial.
Yes.
And I don't think so in near future you put 2035. I don't think so. We will be able to see that time. Hopefully not.
The only concern, sir, till now has been the privacy issues.
Yeah,
because
that's
anything you type, that computer knows that what type of person you are, where is your interest, what is your, it is able to get every information of yours, sir, without your knowledge.
Yeah,
So
that's
that is
unfortunate. Whether it's right or wrong, you cannot argue it also. It may give you false impression about the person. A lot of the misuse can also happen.
That's what I showed, sir. Even if you can show my face and talk something nonsense.
Yeah.
I mean, the entire thing goes like that.
And miscreants can use this for easily to, without being there, they can create havoc.
Exactly, sir. I showed that also, sir. Exactly.
So your email and phone number, please.
I'll do that, sir. I'll send it.
So if there are no more questions, we can end it now.
Thank you, sir.
Thanks. Thank you so much.
Thank you, sir. It was wonderful to have you, sir.
Good evening, sir. Super, sir.
Arey, Philip, so nice to see you.
Yeah, I know, sir.
Take care. Chalo, bye.
Thank you, sir. The recording will be available on the YouTube link @Dr. Sanjay Bedi. And with this, we end it here. Thank you, sir.
Thank you. Thank you so much, sir. Thank you to all the audience.